contribution, you can put it in the chat box or also use the icon, also use the raise hand icon. After you raise your hand and you are done with your intervention, you kindly lower your hand. We'll start the meeting now. Thank you for joining NetRight this afternoon to discuss women's mental health and COVID-19. This webinar is part of this courses and dubbed feminist series under the Ghana Feminist Forum initiative to provide a safe space for feminist discourses on topical national issues of concern to women and girls. The Ghana Feminist Forum is hosted by NetRight with support from the African Women's Development Fund, the AWDF. COVID-19 pandemic took all of us by surprise, and it came along with its dire consequences on our livelihoods, most important, and also on our well-being. So we lost income, when we lost the sources of our livelihoods, but also then it also had consequences on our mental health. The pandemic has seen women experiencing higher levels of mental stress due to loss of livelihoods, increased burden of care, including the general fear and panic of being affected or even losing loved ones. If we will recall, especially during the initial stages, we were all living in fear and panic. You didn't even want someone to touch you because you were scared that you may be infected with the pandemic, with the virus. So if we have to share our experiences, I would say that we all have lived experiences that we can share. Looking at last year, March up to date, the mitigation measures that were put in place to also curb the pandemic also had its own fallouts, which negatively impacted on our well-being. However, if you want to research on mental health, not enough attention has been paid to address mental health issues. That is why we felt it's important for us as NetRight to have these discussions this afternoon to see how best we as women can discuss women's mental issues and how we'll be able to cope with the pandemic. And we have some experienced panel with us, with the moderator, to help us have these discussions. Hopefully at the end of this webinar, we are expecting that there will be an increased knowledge on women's mental health during pandemics such as COVID, and also to enable women to seek early support. We are also hoping that some sort of awareness will be created on coping strategies and recovery processes, including how best we can maintain a positive state of well-being during such pandemics, and even how to protect our whole mental and well-being. So once again, welcome to this meeting. And I would like to invite the convener of NetRight, Pauline van der Palen, to give us a brief remarks before we move on to the panel discussions. Pauline. Pauline, are you with us? If Pauline is not with us, we'll continue, and when she joins us, I saw her, I saw that she has joined, but if she's not with us, maybe she's dropped off. So when she joins at the end of the discussions, we'll get her to give her remarks. I would now like to introduce the moderator for the panel discussion, Susanna Aite, Acting Executive Director of FIDA Ghana. Susan, you are welcome, and over to you. We are hoping that we'll have a 2-hour discussion, and most of the minutes will be assigned to the panel discussion and the contributions from participants. Thank you, Susan. You're welcome. Take over.
Thank you very much for having me. That's right. And thank you so much, Patricia, for this opportunity. And to our virtual audience and panelists, welcome once again to the Feminist Series under the Ghana Feminist Forum, which is hosted by Netrite. And thank you so much, AWDF, for this opportunity. So basically, we would want our virtual audience to really participate in what we are doing. So if you have a pen and paper by you or you are behind a laptop, I just want to go over the objectives briefly so that you can take down some notes and also ask questions if we've left out, some of the objectives. So a review of the objectives, the first of which is increasing knowledge of COVID-19 and its implication on women's mental health. So if you got that, that's fine. I don't want to read a very long sentence. So just jot something down for us. And also to present evidence that women's mental health and well-being must be included in COVID-19 mitigation measures. So I hope we all got that. And then if our policymakers are listening, or if you have any contact with any policymaker, please take notes also to guide you as you share with them. And then the last of the objectives is to also come up with action-oriented recommendations from our panelists. So we're going to start right now, and we're going to do this in 3 phases if time allows. So we look at pre-COVID-19 and women's mental health. Then we're looking at COVID-19 and its impact on women's mental health. Then the recommendations. So a first set of questions will be addressed to each panelist, who will be speaking for at least about 10 minutes. And then we'll do a next round of questions again, which will also take us about 10 minutes. Then if we don't have any questions, which I'm sure we may have, it would also go to the recommendations, but I'm believing that there will be quite, a lot of questions coming from our virtual audience. So now I'd like to introduce our panelists, but I'm just going to do a brief introduction and weave, a lot more of the background in as we speak to them. So first we have Dr. Erica Dixon, who is a physician, clinical psychologist with the Therapy and Wellness Department of Etisabi Military Hospital. Then we also have Martha Kofi, who is also the Vice President of the Mental Health Society of Ghana. And then we have Selik Kemakolache, who is an award-winning journalist, humanitarian, gender advocate, speaker, trainer, missionary, and author. So I'll just weave in, or at least I think Cynthia has put it up for us, some of the background of our panelists. And they are here because they are experts in their own field, and they're going to take us through some of the issues that arose during the COVID-19 pandemic. So I'm going to start off with you, Dr. Erica Dixon, if you can hear me. Prior to the pandemic, we want you to tell us the state of women's mental health in Ghana.
Thank you very much, Susan. I hope you hear me clearly too.
Yeah, at least I can hear you well.
All right, great. So let me say that mental health generally is in a shabby state in Ghana. And when it comes to women, we know how challenging things are for women. It's even worse. We do not pay as much attention to women and our needs. There's so much gender-based violence that goes on. There's so much poverty among women. And all these are risk factors for women developing all kinds of mental health problems. We know also that there are common mental health problems that are more or are predominant among women, such as anxiety and depression. And then there are also mental health disorders that are limited to women, related to hormonal changes and in the peripartum period. So this is the state in which we were, that women had their own plethora of mental health disorders, for which very little attention was being given to. And yet, this is the same group that is very vulnerable in so many ways, with so many risk factors and a lot of gender-based violence directed at them. So making their issues a little dire, and unfortunately we hadn't gotten on top of that, and then the COVID hit. which has come with different or new situation that I'm sure that we'll be talking about later.
Right. Thank you very much, Doctor. You mentioned common problems that pertains to women. And I also read an article that women suffering from mental health are also reluctant to seek medical help. So is this, the experience in Ghana?
All right. I believe that when it comes to mental health, generally everybody is a little reluctant or confused about, is there something that I can go to hospital with? That said, generally for health-seeking behaviors, women do way better than men do. This is a global phenomenon. In Ghana, we see the numbers from our facilities show that there are more women reporting there than men. But of course, we know also that those who are reporting are only a tip of the iceberg. There are many more people out there needing mental health care who are not showing up. So what we are seeing on the ground is not supportive of that article that you read, because we see more females than males in our clinics.
Right. Great. Thank you so much. Okay, so I want to move on to Martha. Martha, are you with us? Hello, Martha. Can you hear me, Martha? Right. I want to move on to Selikem. Selikem, are you with us? Hello, Selikem. Right.
Selikem, please unmute yourself.
Yes. What about Martha?
Martha is with us. So I will please urge that all the panelists put on their camera and unmute themselves.
Okay, this is a question to Martha, if she can hear me. We've heard Dr. Erica Dixon tell us a little bit of what pertained before, the COVID era. So we kind of understand that we had poor mental health issues before, the pandemic. Now, we also know we have a Mental Health Act 2012, and it's Act 846. Can you tell us some 2 or 3 critical provisions, under that act? Okay, I'm not sure if Martha is with us. What about Selikem? Okay,
Selikem,
so
mute yourself.
Okay, I've done that now. I don't know if you can hear me.
Yes, we can. Right, Selikem. Thank you very much for joining us. I was just wondering what was happening to you and Martha. Great to see you. Well, we know that you have been out, in the field as, a women's advocate, missionary. You're also an author, actually, of a book. And congratulations, that was launched in March 2021. That's this year. Now, as you went about, your work, I want to find out from you whether you were able to uncover some unique needs that you found of women and girls who were unduly impacted, by the restriction of movement as a result of COVID-19. And in this respect, is in regard to women's mental health. Yes.
Thank you very much. It's a privilege to be on the platform. I have been working with various women, especially less privileged women, as well as those who fall under the bracket of those who do not have the earning power, as a women in high class. But also, it's been a blend. I, over the period, noticed that there were so many women who were having challenges regarding their economic power. Okay, so many women don't earn as much as men do. And so then during the COVID period, we encountered a lot of women who lost their jobs and were desperately looking for things that they could do to sustain themselves and their families, many of them single mothers. We also discovered that one of the main challenges was access to funding. So if these women who had businesses like a hairdresser or somebody who sells in a shop, a convenience shop, what was the likelihood that she could get a loan easily? And these were very difficult because most of the women that we engage, they're the ones who would come together as cooperatives to find a way of sort of putting their capital together to support each other. So these were cooperatives that they were relying on. But in these hard times, that was absent because people were not able to contribute as they should. So most of them were quite stranded. And then we also found that the neglect by fathers during this period was also affecting many women. Several of them had come, at least 3 of them had come to me desperately looking for some form of help from social welfare to pin down the men and get the men to be responsible by providing for their children. In these times, we realized that the men were just absent. They just sort of went AWOL. Some of them had already denied responsibility of having these children, so it was even difficult to track them down. Those that we even use religious organizations to track, it was difficult to get them to act. And I'll come to the specifics and the cases and why I'm talking this way, then you understand. Also, we found out that some girls who were facing different forms of abuse in their homes or in their communities were now and were schooling, who had the school system as a form of escape, were now cornered in their homes with these same perpetrators not having any form of escape from the situations that they were in. So it was quite difficult for them. Access to basic sanitary needs like sanitary pads was a challenge. And so at a point, we did have to go out there and give out some sanitary pads. And then you also had women like the Kayaye, the headquarters, also going through so much because they were already sleeping outside when the pandemic hit. And so there was virtually nowhere to go. Some of them had to go back home, but others were still hanging around in our class, still sleeping in the open during the lockdown. That opened them up to all forms of abuse, criminal activities. Their monies were being stolen. Some of them are being raped. And if you see, if they tell you about their experiences, how these things happen to them, it's so sad because they're in the open. Anyone just gets a blade, cuts through their clothes, and just harasses them, abuses them. There was one case of one Kayayo who actually lost a baby because someone stole the child. Only God knows what happened to that child. And then generally, poverty. I mean, poverty, if you're looking for what poverty looks like, you would see it in the eyes of a woman or in the life of a woman. Many of them were struggling to just make ends meet and just find a means of survival for they themselves and their family. And there were various forms of gender-based violence that we encountered. Some also women who were going through some form of abuse, emotional abuse in their own homes, in their marriages. All of these things came up. There were women who we encountered who were suicidal, that we had to refer to counselors to speak to so that they would, come out of that phase. So these were some of the things that popped up during COVID-19.
Right, just a follow-up question. I know that Dr. Erica talked also about poverty and gender-based violence, but you just mentioned the issue of, suicide. Now, can you give us an experience of a woman who really felt suicidal? Is it as a result of the impact of COVID-19, or is just one of the issues that, you've mentioned?
Okay, so in this particular case, this was a young lady who had recently gotten married and apparently was having some challenges in the home with the husband. So they were having difficulties. Now, work was an escape for her, but now she had to work from home. And I'm not talking about somebody who was economically challenged. No, I think they were doing very well. They're doing very well. But we got complaints that she had called a few family relatives and friends to say that she was going to kill herself. And so we had to go and call her and talk to her. At the time, she had locked herself up in a room. I was crying and was trying to take something to just take away her life. And this was just because of some emotional abuse that came out as a result of a disagreement between herself and the husband. And so this is a typical case of one of the incidents we encountered, because she did not have, again, that quote unquote escape of going to work and avoiding the man that she was having challenges with. Now they had to be at home. And then this is what happened. But thankfully, we got other experts to speak to her, and she backed down on her decision.
Great. So you were able to get her some help even during the restriction,
Yes.
of movement.
Exactly.
Yes.
Exactly.
Okay. I'm not sure if Martha is with us. If she is, Martha, can you say hello so I can know if you're with me or with us?
Hello.
Great.
Hello.
Great. Good to have you. Right, Martha. Thank you so much, Martha. We were talking about women's mental health needs prior, COVID-19. However, we had to divert a bit or deviate a bit with Salikem telling us about some of her experiences, on the ground. So I just want to go back again and talk about women's poor mental health, before the pandemic. What was some of your experience, or what have been some of your experiences as the vice president of Mensa?
Hello.
Hi, Martha. Did you get my question?
No, please, can you repeat your question once more?
Okay, so good. So I said we had been talking about poor mental health of women prior to the pandemic. And since you've just joined us, I wanted to find out from you as a vice president of Mensa, some of your experiences, with poor mental health of women prior to the surge, the COVID-19 surge.
So we were having issues of underfunding for mental health treatment and care. We were also having poor quality care, as in good mental human rights, and then patient-centered services. Issues about appropriate medication or alternative therapy and treatment options, and then a high cost of treatment. And these are some of the issues that we were having as persons living with a condition. And then we were also having problems as of getting empowerment ourselves, and then information about our conditions, so that we can be able to our mental well-being and protecting our mental health. These are the issues that we were going through, we were facing before the pandemic came in. Treatment centers are not that very much. We have about 80,000 people being tipped per a psychiatrist. And then also we only have a gap of about 98% of our total population right now.
Right. Thank you so much. We understand that there is also... Hello, Martha.
These are some of the issues that...
Okay, your connection is quite weak. However, we did get what you said, which are quite serious. Poor quality care, the issue of lack of information, treatment centers, we don't have enough, and even the poor ratio of psychiatrists, to women or people with mental health issues. I'll get back to you. I'm hoping that you would your connection will be a bit more stronger as I get back to you. But I'm going to Dr. Dixon. We've heard a little bit from Telecom about some of the issues that came up, women being suicidal. And I was quite glad that, the lady was able to get help during the restriction of movement. However, I really want to find out from you also, what kind of, other stresses emerged from COVID-19 that affected women's, either physical or mental health?
Thank you very much. As far as stresses are concerned, of course, there's a general stresses that we all as a people with something so new faced. The fear, the anxiety, just the fear of the unknown was lurking above everybody. And like Selikem said, we know that gender-based violence is rife. And here we had many people who were stuck at home. nowhere to go. The challenge of, even for those in, let's say, middle class who work, to be working from home. You're working from home, you have your children all around you, mommy this, mommy that, and we know how it is here. The children are solely the charge for mothers rather than fathers. So even if there is a father and there's a mother both working from home, it's most likely that father would get to be in the study quiet and do his work, whilst mommy has to do her work and still take charge of the children, watch over them, make sure in between they have to cook, and so on and so forth. And yes, poverty is real among many women. Now let's take a market, somebody who sells in the market. You have to leave early in the morning to the market, and the sheer number of people that you have to interact with already puts you at risk of getting the COVID. And we know how Ghanaians are not always conscientious about keeping protocols. So the risk of catching the illness was very much rife in the kind of work that women do. Women are in the marketplaces, and we know that for the workforce of healthcare workers, the front line, the majority are women. Indeed, the statistics say 70% of frontline workers are female. And these came with special challenges. Now, I'll give you an example of such. The Ghana Psychological Association, in trying to help, put out many numbers so people could reach. And a lot of women called in, most of which was issues with marriage and being abused at home and so on and so forth. And I remember engaging one young lady who is a frontline worker. She was so disheartened. She was ready to quit her job because when she gets home, her husband said, hey, don't get close to the children. So she's virtually blocked off from everybody. Here she is, being at work, taking care of people, seeing death, and you think home is the safe haven. And so to get home and be treated as such, that's not very pleasant at all. And she was at her wit's end. So these are some of the realities that women had to face. And as Selikem said, whether you like it or not, the men, it's easy for them to get away. But you, the mother, can't easily leave your children. And you are forced and pushed to fend for them even when you have nothing. These are the realities that women had to face or still are facing. These are some of the stresses that in this COVID period they've had to deal with.
Right, we are still not out of the woods yet, as we are hearing all kinds of variants, emerging. Yes. So that basically, then you are both saying that women have different experiences from men when it comes to the impact of COVID-19, and it has accentuated or heightened gender inequities, which also, has resulted in worsening mental health for women. Now, Dr. Erica, you did mention the psychologists, did I get it right? Association. Talking about some of the data. Do you have any data as well that shows how COVID-19 has affected women's mental health?
I would say that at the clinical level, yes, we have data. Yeah. And at the clinical level, what we are seeing, especially in our facility, is that there's about a 50% increase in the number of cases that we are seeing. So wow. we are seeing an average of about 230 to 250 people in a month, which is a far cry from what we were doing in the range of about 130 to 150 max. So that shows you a huge jump. And clearly, every month to month, you see that the number of women far outweigh that of males, at least in a ratio of 1 to 1.5 to 2. Mm-hmm. So this clearly, the data is clear on it that yes, women either are in more distress or are seeking help for mental distress.
Right. I was actually going to ask you to appraise our healthcare during the surge in COVID-19, and I think you've given us a ratio. Could you repeat that ratio for us, please?
1 to 1.5, where 1.5 is the females, yes, the women at a higher rate.
Right. Okay.
Common
great.
problems that are showing up. Yes.
Right. Good. It's quite interesting that you did mention, the issue about the frontline worker whose husband felt that because of her interactions with, patients or people who had maybe COVID, she was actually, denied access, to her family. And I think that in itself can actually trigger a lot of, psychological issues. I just wanted to do a follow-up and find out from you how the social distancing, fear of infection, have made an impact on women during the surge of the COVID-19. Because you just mentioned this. Do you have any other experiences, any other stories that could give us an indication of how this actually, affected women and their mental health?
Okay, so I have mentioned the fact that many healthcare workers or frontline workers are women. Yeah. One other observation is that women are more affected by the pandemic. However, there are a lot more men that have died from the COVID. It's clear. And why that would happen is that I told you earlier, men have a terrible health-seeking behavior. They'll wait till the last minute, This means that there are a lot more women who have been left widowed. And so one of the other things that we are seeing is a lot of women who have lost their husbands in this pandemic and are struggling, to deal with it, the grieving and the adjustments that they have to make to this new change. For some, they were solely dependent on their husbands and suddenly find that I don't have any other source of support. And even for those who are not solely financially dependent, the loss of any loved one is difficult and it takes adjustment. And in times where you had support coming in, a lot of people would come and commiserate with you and share love in various ways. Now we are social distancing, and therefore they cannot come and live in your home. In fact, they can't come home. At best, they can bring some things and leave at your doorstep and so on and so forth. So it's really awful for those who are going through this. And that is the other phenomenon that we are seeing a lot of.
Thank you so much. Martha, are you with us?
I'm with you.
Oh,
please,
great,
can you hear me?
Yeah, we can hear you now, because earlier on we were having a bit of a challenge with you. Right now, did you also receive any information regarding the impact of COVID-19 on some of your members?
Yes, we have a few of our members relapsing due to losing their social interaction right to friends coming to visit them, and they having the ability to move through and forth for the fear of contracting the pandemic, the virus. And then we also have some of them who really could not come by any financial assistance, because whilst the pandemic was going on, every activity that our organization was having to protect them, financing them in all means, all were stopped. Everything came to a standstill. So there were no way that they were able to get any resources from us as an organization. And also we have a lot of relapse issues at home, whereby
Okay, right, Martha. Martha is it's out of Accra, so we just have to have a little bit of patience for her line. Thank you so much, Martha. I don't know if you are with us again. But what I got from you was the issue of relapse that actually occurred for women suffering from mental health, disorders, and as a result of lack of social interaction because of social distancing. Yes, I think you're trying to speak, but it's not coming through well. Martha, can you hear me? Right, Martha, I'll try and reconnect with you again. Right, so Salikem.
Right.
Yes, we have a Mental Health Act. As we know in Ghana, we always have legislation. This one is hello. Okay, Salikem, can you hear me?
Yeah, I can hear you.
Right. So, like I said, we have a Mental Health Act 2012, Act 846, and it's one of its aims is to ensure the rights of persons with mental disorder and mental, health. It's also a human rights issue. Now, from your field visits and interactions with women with mental health challenges, what were some of the rights abuses that you identified, which you haven't talked about yet?
Well, I can only talk about two, because in one case, we're dealing with a woman whose son has cerebral palsy. And so this is a 12-year-old boy who has cerebral palsy. And what happened to her was that during the lockdown where they were living, the boy had an episode. So in this episode, he would sort of be epileptic. And then the landlady noticed that this had happened, got upset with her for not disclosing fully that this is the condition that her son has, because this boy walks, is not able to communicate well, but from the onset, without him talking, you would feel that everything is okay with him. He doesn't have any challenge. And so she said that the woman wasn't forthcoming with her and didn't disclose this to her and threw her out of the apartment. So she had to desperately look for another place to live with her son. And this is a woman whose husband decided to abscond and neglect the marriage because the boy had been diagnosed with cerebral palsy. He said he didn't want to have anything to do with the family, and he just left this woman alone with the boy. So they had to find somewhere to quickly get, and then they moved to a single room apartment, a leaking roof. We had to go out into the public. I had to put her story out there. We had to solicit for funds for her to support them, because even food to eat was a problem. She had lost her job. We finally managed to secure a popcorn making machine for her, which she uses to sell popcorn, and that is how they've been getting by. We tried to trace the boy's father and traced him to a church, even petitioned the leadership of the church to get to him so that he can at least support the boy's medications, which cost about 1,200 every month. But the church said they were investigating, and before we realized, he had left the church. And up till now, we are still trying to track him down to get him to support. So in this particular case, you can see clear ignorance on the part of the landlady, who just probably just concluded that this was demonic or devilish or whatever, and then decided to get them out of her house during the partial lockdown, at a time that most families were so desperate, but of course, she didn't seem to care. Now, this brought on an extra stress for the mother, who wasn't working and didn't have funds to rent another place of stay, so had to reach out for us to gather some funds from the public and support her with. So I see that with mental health issues in this country, there is a certain lack of understanding of the issues themselves, and misconception about it, that once it pops up, it is a spiritual matter and cannot be a mental health issue. There was also a case of a boy who he had a certain disorder where he kept going on and off sort of awareness of his environment, his surroundings. And so when he had, during the pandemic period, he had a relapse. Well, we are still in the pandemic. He had a relapse. Family immediately sent him to a prayer camp rather than sending him to the hospital or going back to where they were seeking help, which was the Accra Psychiatric Hospital. They decided to rather send him to a prayer camp where he's living in some sort of bondage and they're praying over him and all of that. I'm a Christian and I love my Jesus and all of that. But we don't have, I see that the understanding of mental health issues is so lacking that there's a fear that people will stigmatize you for seeking mental health care. For instance, there is also a perception that it does not exist, and that because it does not exist and doesn't have a medical cause, it must be a spiritual problem. And so therefore, right away, we just condemn these people somewhere and then get them into even more serious forms of abuse. Because the pictures I got from this boy who is at the prayer camp, I mean, this is not how any human being should be treated. And if there was a certain hands-on collaborative approach between mental health care professionals, the hospitals, as well as social welfare, that coordination was there, then at least it would be easy to always track. But because everybody seems to be working in silos, it's difficult to connect the dots. And so we seem to be having a challenge. It's very sad. I want to share one thing finally. With
let's hold on to that. I'll take that from you later. I really want to speak to Martha as well. Martha, you've heard what Telecom said, and I'm sure it resonates with you as well. Now, I really want to find out from you, what kind of safe social support can we put in place to improve women's mental health, particularly in this COVID era?
Please, I hope you're hearing me.
Yes, we are hearing you.
Yes. So going forward, we should be looking at having open community or roundtable bright conversations within the Ghanaian setting, within our communities and our churches, with our traditional leaders, because that is where we are having all this form of stigma and discrimination and the ignorance about mental health problems being a condition or an ailment rather than being associated to mere myth and then religious beliefs. And then also we are looking at partners or stakeholders within the mental health scope together with state agency. In fact, governments have to be deliberate and intentional, should have the political will to want to collaborate with various institutions who are going to see to it that collective efforts and measures in place so that people can access quality mental health care and services. Please, I hope you're hearing me.
Yes,
Hello?
Yes, we are.
Yes, so we are talking about halfway homes that people can go to and have rehabilitation care and therapeutic measures. We are also looking about social marketing or social corporate social responsibility, taking up persons with mental health problems, train them to become champions so that they can be at the forefront in sharing education, knowledge and information to sufferers of the condition themselves, the family at large, and then the society. I'm also looking forward to increasing funding. The state should invest in mental health, because when you talk to MHA, who is an authority of mental health affairs in the country, you realize that everything about mental health is underfunded. You were asking me previously about some of the provisions within the Mental Health Act, which is funding. And as I'm talking to you now, probably our Mental Health Act, together with the legislative instrument, should have been functioning to oversee some of these things, as Selikem was saying. But because we do not provide within the Act the streams of funding, it has been withholding. And for this reason, this is why we see people doing it in fragments, and we don't have a collaborative effort. And I also want to correct something. Faith-based care is part of our CPNS, or community with cheap compound services that we have in our country for now. So when we talk about SHAG, they also have partners with the various cheap compounds where they correlate or direct members of the Christian or religious associations to the community mental health nurses that we have. So this is the truth. I earlier on spoke about alternative treatment. So we have come to realize that faith-based is also part, since we are talking about human health in mental health now, that it has evolved. Faith-based care, it is part of the treatment. So we should rather come up with policies that are going to regulate and monitor, so that we will see that the human rights of persons suffering the conditions are not trampled upon. So this is what I can say.
Right, thank you very much. Just a follow-up question. The LI on the Mental Health Act, is it in place? Do we have
yes,
an LI?
It is. No, because a section of our act is supposed to provide where we are going to take our levy for the mental health funding. And because of this, they have to hold on, and then there has to be either a reform or a repeal of that section to be specific on where we are going to get those monies from. That is why I'm saying that we going forward as a country, we can see to it that corporate social responsibility come in. The churches are there. They have made a lot of money out of people within the community. This is the time for them to show back the love that they have received from the populace. They can take up some of these issues. So when we have social marketing contracts with them, when we go to them with proposals, then probably we can be using some of these avenues to get the streams of channel for the funding. That's the mental health fund. Also, we can be charging sin taxes on products that are unhealthy. Some of these sin taxes can also be channeled into the mental health fund, so that we will have the finances that we want to be able to give proper and good mental health care services.
Okay, thank you very much, Martha. That has been very exhaustive. I'm going to Erica before I open it up for others to also ask more questions. It's been very interesting. And talking about access to mental health care, how can we improve this? And then a follow-up question would be, can we also encourage mental health screening? Is that possible, like we do with breast screening, eye screening, and all the other screenings that we do?
Thank you very much. So yes, I agree with Martha. And to add to it, the best thing that we can do is to bring mental health care to the primary care level. As it stands, it's a shame, but not all general physicians are well versed in how to assess persons with mental health disorder. And so if we can improve training, some continuous professional training for all physicians, all primary health care level practitioners, to be able to recognize, for example, that this person who has shown up in clinic almost every week and you have done all sort of labs and it says nothing could be having mental which they are sympathizing or showing in physical terms. It is, I have noticed, because ours is a general medical practice, that there are a lot of people who feel more comfortable showing up at say 37 hospital for mental health screening. And for the younger group of people, they show up and ask, have a
Sorry, Erica. There's a lot of feedback coming from somewhere. Could we please mute our mics for those of us on listening in?
They mean well, and they meant well. They mean well to stand for God. Hey, I mean, the thing that has gone on, the way they've insulted Bishop Dan's mother. I mean, they insulted him.
Yes, everybody else besides us.
We just have to pray.
Okay. Can we please mute our mics?
let me give you the number and then.
There's somebody whose mic is on and she's speaking on the telephone. Can she please mute the mic?
Okay, 0244 26 1342. 1342.
Cynthia, could you please put it up that people should mute their mics? We are still hearing the feedback. Okay, I think this is better. Sorry, Dr. Dixon, can you just repeat your last sentence? Yes.
Yes. So what I was saying in summary is that we need to bring mental health care to the doorstep of everybody. If you can walk into a primary health care facility and receive some level of mental health care, that would be great. And sometimes, yes, I know that the numbers are not enough. But that said, there are a lot of people who are trained and professional psychologists who haven't been employed. So if we can advocate for those who have the training to be employed, so that even for every district hospital, there should be at least 2 psychologists, it brings care closer. We have community mental health officers and nurses out there to support these psychologists. And yes, if we have a system like that, the very few psychiatrists won't be stretched so thin. So bringing care to primary care level is essential. Training those who are already in the system to be able to identify and refer appropriately is crucial. And then the financing is terrible. So mental health care is supposed to be free, and with a stress on supposed. On paper, it's supposed to be free, and this may happen in, say, the only 3 psychiatric hospitals. But if you come into a general hospital, it's not covered by your health insurance, and you have to pay out of pocket. This needs to be changed. Why can't we incorporate mental health care into the health insurance that is covered by our health insurance, so that people don't have to continually pay out of their pocket? And schools, charity, they say, begins at home. When we are young, we need to have these healthcare education at that level. Have school counselors that these children could be able to seek refuge, and have their emotional needs met. Because when their emotional needs are not met, it's going to be difficult to study anyway, and they're not going to do all right. So it is an essential part of giving them the comprehensive education, making sure that all facets are covered. So as far as that is concerned, I believe that these are some of the things that we can do. Your second question, if you can repeat again, was to...
Okay, I'll just come back to the second question, but I just want to allow people to also ask questions, because okay. I think we have a little more time for questions to come through, so we can tackle that later. I have Sefako's hand is up. Cynthia, could you just unmute her mic? Faustina Boachi is also, her hand is also up. So second person, Faustina. So I have Sefako and Faustina's, hand up. Could you please unmute their mics for them to ask their questions?
Yes. Unmute yourself, and then
thank you. Please, can you hear me?
Yes. Can you speak up a bit? Is that Sefako?
Yes, this is Dr. Sefako. Yeah.
Okay, Doc. Yes. Great. Let's hear you.
Much. Yeah. I'm so happy we are having this type of dialogue. I'm actually coming from the perspective of women with disabilities in general, but as we are talking about mental health, as Doctor has already lined up some of the things we can do, I am actually holding our conscience towards policy implementation. Because how do we do all these things if the policy actually is not working for us? As an advocate, we have been talking about we need to do this for a long time in Ghana. And I just want to put it out there that is it actually time for us to put some things in place? For instance, I'm presently talking from the US, and we have some things lined up as we are practically doing, aligning the policies to practices on the ground. For instance, mental health right now, we are trying to implement it through independent living philosophy, that we empower the women who have mental health issues practically with some of the things that they have to do. Not that we have to say that we have to do this or these are some of the things, but we want to involve the policy makers. As Martha is here, Martha knows me very well. And we want to see how we can implement the independent living philosophy, which we don't have, even though we talk about communal life of people in Ghana, but we don't have that philosophy to empower women with mental health. So I just want to ask if this is possible to do in Ghana also. Thank you.
Right. Okay. So please, panelists, just take note of the questions. There are quite a few hands up. Faustina, are you there with us? Can we hear you? Cynthia, please unmute Faustina Boache's mic.
Susan, they will have to unmute themselves. Cynthia.
They'll have to unmute themselves. Okay. All right. So please unmute your mics. Judith, I've seen your hand up. I saw Faustina's hand up. Patricia, your hand was up as well.
Yeah, my information. So maybe I quickly share it before we pick the next one.
Okay.
Cynthia has a link on the chat box for us to write our names and phone numbers. So please, we need all of us to click on the link and write their names and phone numbers on it. Thank you.
Okay. Right. So Faustina Boache, can we have your question? If you unmute your mic, we would hear you, I'm sure. Okay. Judith.
Hi. Thank you very much for this discussion. I've never really followed mental health until I realized that a friend of mine was going through something like that. So my question is that where is the safe space in Ghana for people going through issues to go to and not feel victimized or not feel that they are being tagged as crazy? Because I'm not a medical practitioner, yes, but I definitely know that somebody close to me is going through a lot, because this is somebody who is now saying that, oh, we are all going to, she's constantly talking about death and why it wouldn't be a bad idea to even end your life. Like she's going there. So my question is, in Ghana, where is the safe space where we can take people who are close to us to seek for help?
Right. Okay, let's take the first two questions. Dr. Dixon, would you want to tackle the first question by Dr. Sefako?
All right, if I can tackle the second first.
Okay, go ahead.
This sister seems like there's some urgency. There are not enough yet in Accra. I can say confidently that you would find most of the health facilities have a psychologist or psychiatrist and some mental health nurses. So at Lekma, at Achimota, at Accra Regional, that's Ridge Hospital, at 37, at Police Hospital, at Kolebu. These are some of the big areas that you would definitely have a practitioner to attend to you. So you can go to these places. And for somebody who is suicidal, maybe I can share with Cynthia to put out later. There are suicide call lines that you could call on to have at least a support online, or to be directed to your nearest possible facility so that you can speak with a professional who won't judge you if that's the concern. It's unfortunate that our law still frowns on suicide and criminalizes it. And so those who are going through this are sometimes reluctant to show up at hospital with a fear that they may be arrested, they may be locked up. And I think this law has outlived whatever the purpose was, it's one of the things that we need to advocate for to check out, so that people can feel free to express how they truly are feeling and get the necessary support. As far as the first question, unless someone else wants to take it, independent living, I won't profess to know too much about that. I understand that in the US, it's a policy that helps for persons with disability or persons living with disability to, as much as possible, live an independent life, support it. Why not? I think that that's what we all want, the dignity of everybody. And if it is possible to have a policy like that, that would support our persons living with disability to live independent life, to be contributors to their community. After all, good mental well-being means that you are able to reach your full potential, you are able to cope with the daily stresses of life, and that you are productive and fruitful and contributing to your community. So everything that it takes to get each and every one of us to as close as perfect in these parameters is what we are all looking for.
Okay, thank you very much. Yes, thank you very much, Dr. Dixon. I see Faustina's hand up. Faustina, can you talk now?
Yeah, I wasn't unmuted by the organizer, so I had to talk through WhatsApp. And thank you. Especially Sedinam, Selicam. Yeah, I would like to find out, and then Madam Martha, I want to find out whether when you went round, you find any cases of elderly women being blamed for COVID, the incidence of COVID, whether elderly women were also affected by any violence or any, acts of accusations of having brought about COVID, or the incident of people dying from COVID. Generally, women accused of, witchcraft because of COVID and during the lockdown. Thank you.
Okay. Can we take another question before Martha or Selicam responds? I see Vida Inkum and then Mariama Adama Isa. So whichever one of you has your mic unmuted, can you please speak? Vida or Mariama? Mariama says she can't unmute. It says only organizer can unmute. Cynthia, can you help? Okay, let's try and respond to Faustina's question then, whilst we are trying to unmute people who have questions. So who wants to take this, Martha or Selicam? Which one of you wants to take this? A question was
I
want to take that.
Hello.
Well, in my engagements, I didn't encounter.
Okay, just a second.
Hello, I
Selicam,
think I'm
just like a
unmuted
second.
now.
Okay, who's speaking, please?
This is Mariama. I think I'm unmuted
Okay, good.
now.
Mariama, yes, please go ahead with your question.
Thank you very much for the opportunity. I think that the issue of mental health for me, I think is the outcome of so many things that women are confronted with. And we need to unpack the issues within that, or what leads to the whole issue of mental health. And at the moment, the Global Affairs Canada is doing a scoping study to look at the issue of unpaid work. It's one of the bigger issues for us as a country. A lot of the work women do is unpaid. I heard somebody talk about independent living. If, as a woman in Ghana, most of your reproductive work and some work that is so productive that supports the society and it's not paid for, I'm wondering how many women, a few of us may be able to live independently because we have jobs and we continue to earn a living. But the majority, as you know, statistics shows that a lot more of the women, because of social norms and all of that, don't have that capacity and so are constantly stressed, and stress leads to all kinds of health problems. So I think we are looking at the issue at the end, the outcome, the end result that is so damaging to women. We have to revert our minds back and try to unpack all the causes that leads to this issue of mental health so that we can deal with them level by level, stage by stage. It's a bigger concern. I think it's a good opportunity to look at it from as the discussions are ongoing. But there's a lot more work that needs to go back to the source, the root causes. And we want to change norms. We want to ensure that systems transform to be able to address these issues. So going forward, I think we have a lot more work to do. So that's the comment I have, but also to say that to NetRight, that I'm seeking information on the issue of unpaid work because Global Affairs Canada, some other DPs are interested to begin to do projects and programs along that line. So I think it's a bigger agenda, and I thank for the medical doctor for the insights that you gave us, but we need to do a lot more work. Thank you.
Thank you very much, Mariam. A lot more work needs to be done, truly. I so agree with you. Systems must transform. And pay care work, I know ActionAid has done some work on it. So possibly you could speak to ActionAid and see what they have, and probably that could help you. Now let's try and address, I have a few hands up, but I'll come to you. I know I saw Dorcas, one Dorcas up, and then I also saw Vida Income. So please come back to us. Let's try and get from Martha and Selikem. Your responses to Faustina's question about if you saw the elderly women being, accused of causing COVID. I think that's what I got. I don't know if there's anything else. Maybe I missed out on something. Faustina, are you there? Did I get everything?
Sure. I think you did.
Okay, Martha. Yeah.
Yes. So actually, during the pandemic or after the easing of the restrictions, neither do we come by any situation of the aged and the elderly, but we already know that we have instances and issues of stigma and discrimination and myth concerning mental illnesses like dementia and Alzheimer's, where we have the elderly people forgetting themselves even whilst they are eating their food, and then you get to them, probably they may be telling you they have not eaten for some period of days or a period of hours. And because of some of the symptoms of these conditions, people tend to label such people who have the condition out of ignorance for them to be like witches or wizards. So these are the situations, these are the realities, these are the contributions to elderly people being called witches or a wizard because of conditions like amnesia or Alzheimer's or dementia in old age. But during the pandemic, never really did come across anybody being accused purposely because of being a witchcraft to the pandemic outbreak or something else. I think Selikem can also come through.
Okay, right. Selikem, just before you come in, I'm seeing WOM, the Widows and Orphans Movement. They also said they did a scoping study to assess impact on unpaid care work due to COVID-19. So I guess they may have some information. They said they are willing to share. So Mariama, you asked the question about unpaid care work. And so we have had a response from the Widows and Orphans Movement. And I think you could get in touch with them for them to share what they have. Right. So Selikem.
Thank you.
Yes. Yeah.
Right. So we didn't encounter anyone who was accused of causing the COVID, any elderly woman. No, we didn't encounter that. But rather, I would agree with Martha on that point that you still had persisting, especially dementia, being misinterpreted as witchcraft for elderly women.
Yeah. Thank you.
Okay.
Dr. Dixon,
So
Alzheimer's and dementia. Now, we don't have much information about that. People don't really understand what happens to the elderly when it comes to Alzheimer's and dementia. What has been your experience as a medical doctor?
Well, there are, it's people perceive that when you grow old, you definitely would get demented. This is not true. There are many people who get this disease, and sometimes it can even start in early or midlife. So in your 50s, you may start getting forgetful and so on and so forth. And then your mood may get affected. It's unfortunate that when people have any kind of mental illness or neurological problem that we do not understand, we say they are witches. It is usually the women who are attacked this way, but when it is male, it seems to be okay. That's what some of the gender biases that we encounter. But yes, this is a disease condition, and it can affect anyone, and especially where you have a family history of such, then you know that you could also get it. So should anybody experience this forgetfulness and a low mood, and sometimes even getting aggressive a bit, and general confusion, I think the first thing to do is to seek help, and let your doctor know, or somebody close to this person should take that person to seek help. And indeed, the neurologists are the persons that are best equipped to deal or to handle or manage such cases. There again, unfortunately, we have a handful, but your general practitioner would be able to do the initial assessments and then refer you to the neurologist. It's not curable, but they can slow down the degeneration that happens. And the earlier you find out, the better the outcome, because interventions are brought in quicker and the outcomes get better.
Right. Thank you very much. I'll come back to you, Martha, regarding Alzheimer's and dementia. There were some others who had, their hands raised. Please come back. Vida Income, Dorcas Asa, I think, and then Bashira too. I think I saw your hand up as well, but it's down now. I just wanted to address the issue of independent living. I think I've seen that it happens in the Western countries. And for instance, in the UK, they do have, flats that are built that really are built to suit persons, with mental health issues. And then there are sometimes there are health, practitioners around who also supervise the activities. But here in this country, we don't have those kind of resources where we can build, flats for persons, who are suffering from mental health. An idea I think for UK was to try and take them out of the institutions because they were institutionalized, and they felt that they believed that it would be better if they lived independently and enjoyed certain rights. So it looked like they had been incarcerated if they were put in an institution that takes care of persons with mental health issues. Okay, so I see Sefako, Dr. Sefako, your hand is still up. So can you please come through with your question?
Thank you, Susan. Just a clarification.
Right.
As you just read about what somebody submitted in the UK, I managed that particular program in Vermont State presently, but in our case, it's not like that in the US. It is not institutionalization, but it's rather what somebody has also requested. If we have such a resource for the people, it's kind of connected to the healthcare, the police, all the providers, but it's a unique entity which is there to walk to at any time when you have any type of issue you want to pour out. There are so many things as a package, but I remember somebody also asked if there is such a place in Ghana for us. So the independent living, it's actually not for only the mental health, but we have a mental health section, which I coordinate. So that's why I see the importance of having such a resource in the system in Ghana as well, because it's very helpful as we have the stigma already. because the idea is to make sure that people feel very much belonging and also very much easy to access that resource without any stigma or marginalization. So this is how it works. But I want to also put it out there that we can have a backdoor discussion to see how best we can help. It must maybe start from the association itself. Like Martha, as I said, we have been fighting for the cause for us for so long a time. If it is something that we have to start having in the association with what's the name, Taylor, we can't talk about it because it's necessary to have such a resource in Ghana. Thank you.
Okay, thank you very much, Doc. Martha, what do you think about this? Since you are the vice
Yes,
president.
Yes, like I said, mental health issues have been evolving, and then the human rights aspect of faith suggests when we consider the CRPD and the SDGs, they are all showing or giving indication and goals for us to attain some of these things. But how are we going to attain it until policy framework that are implementable has been set and put in place? We as a pressure group or an advocacy group of persons living with the conditions, we have been doing the necessary talk, but it is hard time. It's long overdue that Ghana as a state should take up the responsibility to present to us the workable frameworks and then the legislative operationalized materials so that we can kickstart from somewhere. Because until we as a nation becomes deliberate and then we have the political will and intentional to do some of these things, we will be having all these nice dialoguings, we have nice policies laying there, but where is the will to operationalize all these nice policies and documents that we are having then? And we've since been talking for long. So it is hard time we wake up. It is hard time we put pressure on the necessary institutions and hold them accountable by the various international treaties that they have signed. We have to wake up, and this has to come from all of us collaboratively, whether you have a mental health condition or not, because a friend of yours will be a person who is also suffering the condition, and it's an open arena. It can happen to anybody because per WHO estimation, 1 out of every 4 people in life, whether true from the infancy or young or youth or during old age, may encounter mental health problems or challenges. So this is a wake-up call. This is a wake-up call. This is what I can say.
Right. Thank you very much. Indeed, if you look at Article 25, subsection 1, the Universal Declaration of Human Rights or on Human Rights, it says everyone has the right to a standard of living adequate for the health and well-being of him or herself and of his or her family, including food, clothing, housing, and medical care, and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, or other lack of livelihood in circumstances beyond his or her control. So the article under the UDHR really, enjoins us or the state to ensure that it provides certain necessaries of life for persons who are suffering from mental health challenges. So the state is also, responsible. We haven't talked about, well, I think Martha has actually spoken about political will, but what else can the state do? I mean, Martha, you really cataloged a lot of things about policy framework, legislative operational material. You also spoke earlier on about the importance of, ensuring that we train champions on mental health, increase funding, faith-based care is important, alternative treatment is important, access quality mental health, very, very crucial. And we need to be deliberate and intentional. What else should the state be doing? And the state has signed on to the UDHR. And so what are some of the things that we should be advocating for as maybe mental health advocates?
So we should be advocating for space and involvement right from a plan initials of policy framework directions, so that advocates and people who are technocrats in best practices elsewhere will join that government steering committee so that we can bring on deck hands-on bright ideas and way forward to be able to cap some of these issues that we have long overdue to see to it that they function properly. I was also thinking about people talking about paid work. You see, elsewhere in the UK and the United States, we have what we call the peer support recruit or respite caregivers who are being taken up either from a CSO or the state. They are recruited as persons with lived experience in the condition, and then they are paid as peer supporters, life coaching officers, and husbandmen who are trustworthy people, can aid other persons in disability situations that they themselves cannot help, or they will need that care. So these are some of the things that we should, going forward, we should be looking at. All these are avenues that we should explore. And until we make it a deliberate effort to want to exploit them, then we will still remain where we are. Others have done it and it is working. So it's a need and a matter of we trying to adapt whatever are those best practices and try to contextualize it to our own situation here or in our context, and then we work with it. And I think we are going to make strides. Thank you.
Right. Thank you very much, Martha. There's a question which I think probably will fall on your lap. There's a question from CSO platform, and the name here is Kuju. And the question is, what are the broad entry points for advocacy when it comes to mental health issues? One, broad entry points, pardon me, for advocacy when it comes to mental health issues. And then he talks about are there any documents or reports that chronicle the gains achieved over the years? So do we have any document? Do we have any data? Yes. Good.
Yes.
And then so let's do the first two, because I think he has about 3 or 4 questions in one sentence. So let's do the first two. The broad entry points.
So it can be with mental health financing, and then services, quality
access
care
to quality
or services.
Care, yeah. Mm-hmm.
Yes, these are the major ones. And then we also want to look at mental health not only being a medical problem, but since we are factoring the human rights aspect of it, we should be looking at it in our various schools. I'm suggesting that we can be having test-free curricula of mental health in our school, so that people actually really will not have to face it as exams and fail. But these are the places whereby we can formulate and change the mindset of the youth or those that are growing and coming up. Because the reason why we are far lacking behind in achieving mental health strides is because of our mentality as a state, our beliefs that and the myths that surrounds mental health conditions. So these are some of the things that we can be doing, and these are some of the areas that we can channel effort to, and then we'll make strides.
Thank you. He also asks about reports or documents that chronicle the gains achieved over the years.
Yes, so like I said, I was citing a 2013 BMC Public Health CASA Psychological Distress Scale that is called a KTHEN. So when they go onto the various internet or the Mental Health Authority web, they can find some of these documentations around there, or MESOC. We have a 10-year mental health policy that is also looking at some of these issues. So when you log on to www.mesoc.org, or you log on to the MAH, that is the Mental Health Authority website, there are some of these documentations that you are going to have about researches that have been done and feasibility or analysis studies that have been done 2013, 2014, and 2020 as a whole.
Right. Do you have 2020 documentation?
Yeah.
Because I tried to look up for some information. I was only getting 2010, 13, and 14.
No,
right.
I also have one. Yes.
Right. Yeah, go ahead. Martha?
Yes, please.
Yes, you were saying something. I lost you.
Yes, I had something on 2020 about the mental health poor mental health situation in Ghana, who is at risk. And so it also comes with the 2020 analysis that was done by MTech, Mental Health IT Foundation. And so when you Google or you go on the web, you are going to find some of these things available there. They will be telling you about the number of CPNSs that we have, the various cheap compounds that falls within the community central region, Kumasi, where you can access healthcare. It's also going to tell you that we have a partial rehabilitation center in the upper west east regions of the country. So there are these documentations that they can come by.
Okay, so there's another question. That's the last of the questions from Kojo. And he's asking, how does the broader civil society body support or chip in to ensure the factors militating against the mental health issues are appropriately addressed? So this one, I think, any one of us can answer. I believe Dr. Dixon is also a women's rights activist, as I saw in the background. Yes.
Okay. We know that in Ghana, we've been able to move leaps and bounds in certain areas because the general population and groups took it to heart and pushed it. So I believe that if civil society finds this, the matter of mental health generally as essential, and we should, if we are not doing that already, and in the same way that we take whatever issue disturbs us and go ahead and educate. I think the point of entry should be education. People simply don't understand. And so because they don't understand, they're simply confounded. They don't know what they can do about it. Sometimes also the focus is only on mental disorders, illness. But in the same way we have physical health, we have mental health. And a good mental health promotion that would advocate for all of us to keep mental wellness or to work at improving our mental well-being is a point of education that we can start with. When we have done that, then that very derogatory perspective that we have, that when we talk about mental health, it is somebody walking the streets half naked, all tattered. That's what we are talking about. Maybe that is the extreme, and people are afraid of such and may not even want to contemplate it. But the mental illness is you and I. Martha just told you, every fourth person or a quarter of us in our whole lifetime could get it. Indeed, when you look at all health problems, now the anticipation is that mental health is going to overtake even some of the non-communicable diseases. A disease like depression is being projected to overcome cardiovascular diseases. That is huge. Must we sit and wait till that happens? Is there something that we can do? And it behoves on you and I. All of us have a part to play in it. And I believe that the point of entry should be education, education, education. When people have an understanding, then they know what they want, then they will push for all the right things to be done.
Right, there's a lot of lack of awareness and information about mental health, issues. And I'm very glad that you've actually tried to differentiate between mental, illness and mental disorders. That reminded me of the question that I asked you, whether we can do some mental health screening. How can this be done?
Yes. So indeed, for psychologists, for example, we have some tools that you can use to do quick screening. So we may not be able to do everything A to Z, but an encounter with a practitioner asking some salient questions. For example, if you're somebody who has a family member who has a mental health problem, you could be at risk. So in the same way, if you have diabetes in the family, you know that you could be at risk of getting the diabetes or hypertension. It means you need to be a little more conscious. you need to go for a checkup to make sure that all is well. You need to be very aware of the symptoms, so that should you at any point in time feel any of these things, you seek help. But yes, there are tools that we can use to screen for the common mental health illnesses, and sometimes we may go to an organization and administer some of this, and indeed you pick some people with problems, and then you pick these people out and go do further assessment, a more comprehensive assessment that will let you know whether there is an issue of concern or not. So if you're using a screener, the fact that the person is showing, say, high on depression doesn't mean that they are, because there are a lot of mental health problems that may overlap. So they may flag positive or may flag high. Then you do a proper assessment of the individual to find out if they need some extra help. Sometimes the person may just be stressed. Sometimes they indeed may have real problems. And so, yes, there are ways of screening, including screening large groups. And if it comes to people to do the screening, I can assure you, within the Ghana Psychological Association alone, there are enough people, most of whom haven't been employed yet. So let's get serious, and I'm sure we'll have placements for all of these people who would be able to then come and support all of us.
Right. Thank you very much, Dr. Dixon, because I'm just thinking through what Kojo asked about how the broader civil society body can support or incorporate this into the kind of work that they do. So certain people have, okay, FIDA, for instance, that's legal aid, looks at legislation. Yeah. So probably legislation issues for us, and then we're probably doing advocacy around funding, as Martha has rightly pointed out. And of course, those who do lots of services. I mean, most of the women's rights organizations provide services. And I'm very glad that you said we could do, mental health screening.
Let me just chip in that I think that the Ghana Psychological Association, being aware that people have very little awareness, has in the past few years been very proactive in rendering service. For example, when the banks collapsed, we quickly went in and reached out to them that, hey, we can support you with this. And these were things that we did voluntarily, screened them and gave extra support to those needed. Our most recent thing we did was at the APAM disaster, where it became obvious that, all right, there's been a disaster. They're looking at the physical health problems, but what about the emotional needs? And as the president then said, yes, this person may not have a bed to sleep or a shelter over their head, and NADMO has provided a mattress. But what is a mattress to the person who is distressed and cannot sleep? You have brought food, but the person is in no emotional state even to eat. In other words, our emotional well-being is as important as our physical well-being. And this is something that we need to push a whole lot more. Admittedly, there are a lot of organizations that are now coming to that awareness, especially over this COVID period, and therefore engaging for mental health practitioners to support their staff in varied ways, including getting screenings and giving treatment or management or interventions to those who actually need it.
All right. Thank you very much, Dr. Dixon. I'll come to you, Salikan, but I want to find out from Martha regarding the question that Kojo raised about how civil society, body can support. Do you have any ideas as to what you think? I mean, the broader civil society, organization can also do to support your advocacy as well? Hello, Martha. Martha, can you hear me? I think you have to unmute your mic, Martha. Okay, Martha's mic is muted, so she didn't hear me. But let's get to you, Salikan.
All right.
Yes, great. Kweku has actually asked this question, which I believe it's quite pertinent.
Yes,
there are quite a lot of
hello. Hello.
Hello, Martha.
Hello, please, can you hear me?
Okay, good. So, Salikem, just a second. Let's
Yes,
get Martha.
please. Can you hear me?
Yeah, I can hear you, Martha. Martha?
Yeah, so please, you ask the question. Yes, please.
Yes, about,
Hello?
did you get a question?
No, please, I didn't.
Okay, so then Kojo was asking, and his last question was, how does the broader civil society body support or chip in to ensure the factors militating against the mental health issues, are properly addressed? So I'm asking you also some of, what you think civil society can do. Dr. Dixon has mentioned quite, a few, but what about you? What do you have to share with us?
After education, I'm thinking about building capacities of persons with the conditions to be able to have knowledge about their conditions themselves. These are key to us. And then we should also try to give a refresher trainings to practitioners who are not evolving with best practices and quality treatment that is going on elsewhere in the world that is making mental health care and services very, very great or good. So this is what I'm also thinking that can be done by civil society. They can join hands on VEC, look for these practitioners, and then pay for they going through, like we have a e-training in mental health. We have the human rights component of mental health care for practitioners and then persons with a condition themselves. These are some of the things that other civil society brother bodies can be coming on deck with already existing ones that are leading mental health course in the country. And then they join hands on board, they collaborate, and then we pick the
Okay. Right. Thank you, Martha.
Hello, Susan.
Yes, Patricia.
Selikem comes in. I've
Yeah.
seen there is Dorcas Mensah, Bashira too, and there was Ida Inkum. Later, their hands have been for a long time. And I'm mentioning those who have not yet spoken.
Yes,
so,
please.
Yeah.
Vida, Bashira too. I didn't mention their names earlier on. And I think Dorcas, I said answer, but I think it's Mensa. So please, just chip in with your questions before we round up the session.
Okay, so this is Dorcas.
Okay, Dorcas.
Actually, mine is not a question. I think it's more of a contribution. One of us who asked the question was asking whether there are safe spaces for persons who have mental health problems, and one of our doctors mentioned the hospitals, the various hospitals they could go. But I also wanted to add that there are peer support groups. In Accra here. Even I have a peer support group called Others Like Me. And there are lots of people on that platform, and we are doing a lot to help each other. I also know of Psychosocial Africa, and I mean others that I don't remember readily. And these peer support groups are very good in managing our mental health problems, because like we have people on those platforms who are going through similar challenges. So it's easy to relate with each other more than like you would relate with your psychologist or psychiatrist. So I would urge the person who asked for that information for her friend that, I mean, in addition to seeking the services of the professionals, you should also try and get the person to get in touch with any of us. On Facebook, we are there, Others Like Me. Our number is there. On Instagram too, we are there, and we are always ready to help. Thank you.
Thank you very much, Dorcas. I think the lady's name is Judith Ampoma Owusu.
Okay.
Yeah.
Hello.
Hello. Is this Vida?
Hello. Yes. Dr. Dixon made me bringing the mental health education to the school level. Yes, you can advocate more to the curriculum planners so that they inculcate this particular topic into the syllabus or the curriculum, it would be very, very good for us, because a lot of these children, especially the girls, come to school with the minds completely closed. They are oblivious to whatever happens around them. When they look at the abuse their parents go through, their mothers go through, hello, hello.
Hello, Vida. Yes, you're making a great point, but your connection
Hello.
is not strong enough. Yes, Vida, go ahead.
Can you hear me now?
Yeah, I can hear you.
What I'm saying is that some of these children, especially the girls, come to school looking at the kind of abuse their mothers go through at home, and they come with their minds closed. Whatever you say, they don't even listen. They become moody. You call them, you know of things that happen home. And some of these children, they come to school, you realize that they have a challenge. You call their parents to them about it, and the parents will just deny that there is no problem. Their kids don't have any. So in that situation, what do you do as an educator? Because you cannot recommend a child to a clinical psychologist or whatever without a consent. And here's the case: the parents are not in agreement with you.
Great. Okay, that's a great question. And then I'll probably let Martha or Dr. Dixon address it. But Ms. Bashira too, is your hand still up? Can we hear from you, Bashira too?
Yes, my question is about how do we draw a line in dealing with issues of mental health and religion? And what is the Psychological Association doing about it? I'm asking this because in the Zongo communities, there is this very great perception around what they call alijanna, which is genes, the spirit of genes. So immediately someone start exhibiting some trait of either depression or anything, they tag it to possession. So a gene has possessed you, and they will take you to the house of a malam or someone who knows the Quran. They are people who specializes in that, and you will be there for some time, and all mostly they do is that they will be playing loud music in your ears. They will be reciting Quranic verses in your ears. At some point, they will be beating you that they are beating out the spirit, from your body. But then the pain is on you, the person who is actually involved. And in the times of COVID, because we were all stuck in the houses and we have a lot of parents in the houses with their children, people were getting to know more, they were getting to know their attitudes and other things. And in the end, some people there were pockets of those issues coming up as well. I don't know what is being done currently around it, but it's a very serious issue that is currently ongoing. And also for us to know that this is mostly done to ladies who are fair, because they say that the genes like fairer women. So they possess them to marry them, and then they become their spiritual husbands, and they need to go and beat it all out of them, or make noise in their ears using the vases or any other thing. Thank you.
All right. Thank you very much, Bash. Martha, can we address Vida's question? What kind of support can we provide for young girls? Is Martha with us?
A little bit. I went off a little bit, and so I didn't actually hear her question.
Yes, yes. The question was, what kind of support can we provide for young girls who need some form of support? Basically, when their parents are not even in favor of, them receiving any form of support from anywhere else. So their parents are opposed to any support being provided, and yet these young girls need this kind of support for their mental, well-being. How do we address this? How do we go around about this?
Yes, so we have the human rights institutions like the Shiraj, that people like Bashirat was saying, the teacher together with other colleagues can report some of these issues to them, and then they can take it up because it's a human rights issue. Organizations also like Mental Health Society of Ghana, the Basic Needs, and GFD are also there that people can come to and then report some of these incidents. And when you have to do with a child with a particular disability, that is a mental health problem, it can be taken up from there. These are some of the things that I can say we will do. But going forward, once more, like in a component in our Mental Health Act, make provision for punitive measures and then committees that some of these issues can be reported to. But because it is not fully operationalized, we don't see much of the availability of places that or centers that we can report some of these issues to. So this is why we are saying that going forward in our education, we should make it comprehensive enough. If we introduce mental health issues as part of the curricula, as I said, then probably teachers, parents will be having the full knowledge about some of these conditions, and that is where we can be able to help render the help.
Okay, I think we lost Martha again. Is Dr. Dixon around? I can't see you,
Yes,
Dr. Dixon.
I'm here.
You are here, great. Okay, so the same.
I think that the Department of Social Welfare is another agency that can be falling on as far as this matter is concerned, where you find that a child is at risk or needs some support that the parents are not supporting. And every district has a social welfare officer. You can fall on them to lend you the necessary support. They are mandated to go to people's homes, and they are well trained to engage the parents.
Right.
And I think
what about
the second
Bashira's?
question
Yeah, good.
religion,
Great.
about religion and mental health care. You know, religion is a double-edged sword. It cuts both ways. It can be extremely helpful. A lot of research has shown that religion takes people out of their sense of hopelessness and gives hope. But at the same time, the sort of things that we are practicing here sometimes puts a lot of people at risk of all sorts of human rights abuses. There is a research that I think is still ongoing with some professionals collaborating with a religious prayer camp. So they go to the prayer camp. These people are in prayer camp receiving whatever prayers and whatever things are done for them there. And then these professionals would go there and assess and give treatment and interventions as is needed. The good thing is that this is going very well. So how are we going to be able to manage this? Professionals need to keep an open mind and buy into the idea of collaboration, because in some cases, these religious persons also have something to offer, if it's not abuse and beating and so on. And so, as Martha earlier said, within our policy or the laws, there's space for alternate intervention. So if we can collaborate and educate or train these persons who are given alternate services to understand this is it, you possibly can support this person up to this level. So whether it's a support group, whether it is a whatever intervention you're doing, there are certain levels that you get to that you know this is out of your hand. This is way beyond your pay grade, and somebody else must step in to help. I know that this practice of tax shifting and so on has worked here in Ghana in the area of deliveries. There used to be high maternal mortality and so on, because most people will go to, say, traditional birth attendants. And how that was solved is that there was collaboration between obstetrics gynecologists and these birth attendants. They were trained to deliver under aseptic conditions and make sure that They understood where the risks are. When you notice X, Y, Z signs, know that this baby is not going to be delivered normally. So refer them to the next level. I think that's the sort of mechanism that we can have in mental health. After all, we have said that there are not enough professionals to go around. And these religious bodies are offering some level of support to them. They are easily accessible to these people. Why can we not train them, educate them to understand the depths of what it is they are engaged in, to understand what they can do and what their limitations are, and to refer them? What is so wrong with a professional attending to somebody and realizing that this person seems to have some spiritual needs, and also calling in this minister or religious person, come support us to give this person the holistic needs that they have? So that is the point where we can help to change the understanding of these people who are rendering the support that we are frowning on. When they understand, they will know their limits. We show them the respect that is due them, and they show us the respect that is due us. And we all recognize that we are all working for the common good of the person living with mental health problem. I believe that that's the way to go. Otherwise, it's going to be a fight. And of course, if the person is going to do that, they're going to do that anyway. Just go underground.
But I think Ashiratu mentioned the issue of rights abuses where they are beating up, and the loud music is played in their ears, and the target fair women.
That is obviously wrong, and so that's where the point I was making, that they don't understand. They believe they are doing something. If they have better understanding, they may not be doing this. I have been involved with some people. So myself at church, one of my young people I realized wasn't showing up at church. Inquired, and they said she has some illness and is up on the mountain in some facility of prayer camp. So we went there to visit. And this poor young lady had been beaten black and blue. You could see all the cane marks at her back. Of course, we threatened these people that we are taking her away. They won't allow us to take because we didn't bring her in. But we assured them that we were going to come back, and we are coming back with the police if they don't release. By the time we got down to Accra, they had called her parents to come and take her away. So they took her away. We took her to hospital, and she's doing well. So I do know, and I'm very much aware that there are all kinds of human rights abuses that happen. But whether we like it or not, these people are going there. That's where they know. They'll go there first. So why don't we do something about the people who are in these places, so that the reception will be different, so that the management there will be different, so that they'll know when to call professionals in to help, and that these people will get the holistic care that they need. Thank you.
Thank you very much, Dr. Dixon. Yes, our time is actually up. I need to wrap up, but I need to get some last words quick ones from all of you. Selikem, will you go first?
Right, I will go first. So I'm glad that Doc mentioned that mental health should not just be looked at as the presence or absence of a mental disorder, so that there are so many factors that lead to the mental condition. Let's begin to look at those issues. For instance, social welfare must be empowered more with a lot more funding. You mentioned that there are offices out there, but you should go to the offices and see. They are not empowered even enough to follow up on irresponsible fathers who end up, because they abandon families, end up stressing these women who end up in these difficult, stressful situations. Also, expanding the access to mental health care is important. The education must be pushed more. But let's look at pushing for the decriminalization of the suicide law. If something can be done as soon as possible to push for it to be decriminalized, it will really help. And we need to push for our country to have a solid social protection system. A solid social protection system that can support victims of abuse on all levels. The shelters are not enough. They're woefully inadequate. These are all things that we must push for. if we have that solid social protection system, we would have a good collaboration between religious bodies, between health institutions, and then if we really care about the mental wealth and health well-being of our women, we need to commit funding to it. If we really want to see women more empowered, healthier, working better, we need to commit resources to it. This is one area that we have been really lagging behind on. Let us be deliberate in looking for the funds to make it possible for institutions that are helping with mental health to be properly financed and the structures to be put up properly so that we can actually know that we are making a certain effort. Thank you.
Right, thank you very much. Okay, so Ms. Martha around? If not, Dr. Dixon
Yes,
can.
yes, I'm
Martha.
here.
Good. So briefly,
So-
brief remarks. What do you have to say about what we need to do where women's mental health is concerned, particularly in our COVID-19 era? Hello, Martha.
Yes. Hello, please, can you hear me?
Yeah, I can hear
Hello,
you.
please, can you hear me? Yes.
Yeah, we can hear
so
you.
I'm looking at, yes, I'm looking at mental health treatment, not as an psychological care and service only. Medicine is not mental health care. It's not health care. Medicine is sick care. But what we have and we should know is that food, good food, care, vigorous exercise, great friends, sound sleep, and mental stimulation are what we call health care. And the mental health or the well-being of any people in any nation is key to their gross productivity development. So we as a country, we as a people, if we want to see the involvement of mental health making strides and change, then we need to collaborate. We need to formulate policies. We have to get the political will. We all need to push this because our mental health is our wealth. Thank you.
Thank you so much. Dr. Dixon, you have the final word.
Well, thank you very much. And to my colleagues, you have made wonderful inputs. We need to, as Martha said, see mental health not only as disease, and therefore promoting things that would give good well-being or mental well-being should be what we should be hammering on. But for those who find themselves unfortunately ill or diseased, they should be able to enter any health facility and get help. We need
That's
to
right.
decentralize mental health and take it out of mental health hospitals or institutions, and we need to make it easier for them to get their financing for their treatment by instituting into the mental health, the national insurance, that mental health should be incorporated in it so that at least they can afford to some level the care where they find that they need it. And as far as counselors in school, it is also essential for mental health. And for me, that is something that we need to push. So let's all get to work and see how we can have this be a reality in our country. Thank you.
Great. Thank you so much, Dr.
Susan,
Dixon. Yes.
In wrapping up, there are 2 contributions in the chat box, so you can add it in your wrap up. Thank you.
I haven't seen them yet.
It's
the last person is, can you read them for me, please?
Okay, let me try and see. From Fosti, she's saying, I also want to state that infrastructure development in the mental facilities need upgrading. Appalling conditions there can even add to worsening their situations. We need to invest there by private sector. So we need private sector investment, government and public sector. So she's recommending private public sector investment in mental health care. And then
Great.
Kojo is saying he would love to see partnership with the film industry to dispel some of the myths perpetuated by film industry when it comes to mental health. So these are the two contributions from Kojo and Foste. And
Right.
and also before you wrap up, I want to say that if you've not, for those who have not completed the form, kindly do so now.
Okay,
Yeah,
thank you so much, Patricia. Are you done now?
I'm done. Please go on.
Okay. Right, great job. And thank you so much to our panelist, Dr. Dixon. Very insightful, comments that you have, shared with us. Martha, brilliant suggestions and recommendations. And of course, I think they form broader, entry points that women's rights groups, civil society organizations could also work with. And Talikam, thank you so much for the work you've been doing, and thank you so much for wrapping up. I think you've all done my job for me, and I appreciate what you have really, shared with us. And for those of you who listened in and who also, asked questions and contributions, thank you so much. Brilliant points have been made. Thank you, NetRight. Thank you, AWDF. And I'm going to end with the issue of safe spaces. It's very important that we have safe spaces. How do we help young girls? How do we help women? How do we help women with disabilities? And how do we help the elderly, which Faustina raised? That was a brilliant point. The issue of Alzheimer's came up. The issue of dementia came up. And I'm very glad we were able to discuss those issues. And also, we need to also look at COVID-19 mitigation, measures. It's time for us to really explore and let policymakers know that it's really relevant that mitigation measures during COVID-19 also addresses the issue of women's mental health. So many issues have come up. We've seen a lot of gender gaps, but I think this, for me, it's really critical. And we need to really get policymakers to, as Martha, I'll borrow your words, said, we need to encourage them to have to show political will to ensure that women's mental health, is improved. Thank you, and for this opportunity. I've learned a lot myself, and I believe those of us who joined have also done so. And I've seen Dr. Sefako saying, great discussion. Thank you all. Thank you, Doctor, for your insightful contributions as well. So I'm going to hand over to Patricia now. Patricia, you can please take over.
And thank you, Susan. You thanked everybody except yourself. Thank you so much for a wonderful job this afternoon, and to the panelists, participants. When we started, we were calling on the convener of NetRight, Pauline, to give brief remarks, but she dropped off. So Pauline, if you are here, just in a minute, if you can give us brief remarks, then
I just to add my immense thanks to both the very capable and able Susan for moderating this in such a wonderful way. And we thank Dr.
Dixon.
Dr. Dixon, Martha, and Selikem for sharing all the insights. I think this has been a very, very successful panel this afternoon. It's been very both informative and interactive, because we've heard from our different members. And I think as one of the feminist forum, feminist dialogues, it shows that there's so many things that are of critical importance that need to be raised in a very loud manner. So just to add my thanks to both the panelists and to the different participants who have joined us this afternoon, and to say we look forward to having you on our next discussion. I think that will be next week, and I'm sure that will be as powerful as this session has been. So thank you.
Thank you,
Pauline. Thank you so much, Pauline.
Thank you. This is the series looks at different topical issues, and I believe we've all enjoyed the discussion on women's mental health and COVID-19. And already we are having requests. Petroleum Ladies Association have requested that they do same discussions for their members. So we'll come back to you, panelists and moderator, and link you up with them so that they can have side discussion with their members. I'll plead with you to put your cameras on so that we quickly take a picture. Everybody, resource persons, participants. We want to see all your beautiful faces, beautiful and handsome faces, so that we can have a group picture. If you are not in a position to put on your camera, that's fine. We understand. So Cynthia, can we have the picture? You tell us when you are done.
I'm done.
I can't see myself there.
So
was I there?
Everybody was in. As Pauline mentioned, we are having another discussion next week on the affirmative action bill, and I hope you would all be able to join us. We will share the link for registration soon. Our feminist series, though it's under the Ghana Feminist Forum, even when that project ends, we'll still continue with our feminist series, and we are urging all of you to propose questions, issues that you want us to discuss under our feminist series. Thank you all for joining us. Thank you, moderator. Thank you, panelists. Bye-bye.
You're welcome. Bye-bye.
Thank you for having us. Dr. Fako, yay, it's the longest.
Thank you so much.
Thank
hey,
you.
Thank you. Hey, doctor, it's a long time. Wow. Thank you, Netright. Thank you, Netright, for making me see Dr. Sefako in a long time.
Oh, that's great.
I just woke up when he said we should take the picture. I'm like, what are you doing to me? Let me just clean up my face.
I hope you have your names on the form, that the link that Cynthia shared. Thank you so much.
So Martha, send me your email. I want to send you some resources to apply to, okay?
All right, ma'am. Okay.
Bye-bye.
Bye-bye.
And now we don't want to leave. Then we should.